Why don't we go ahead and get started? Hi, everybody. Welcome to the 6th Soil, Water, and Climate Seminar of the spring semester. Thanks for being here today. I think probably most of you know me by this point, but if not, my name is Kelly Wells, and I'm a research scientist in the department and co-organizer of the series, along with Vasudha Sharma and Kyle Shervine. And I will be introducing today's speaker in a minute, but just want to mention that our next seminar is going to be just 1 week from today, April 21st, and that will be Dr. Cara Centelli from the Department of Earth and Environmental Sciences, and she'll be talking about her work co-leading the College of Science and Engineering D&I Alliance. Of course, this week with the killing of Dante Wright, we have yet another reminder in our community of the urgency and importance of that work. So I hope you'll be able to join us then. But today I have the pleasure of welcoming Dr. Claudia Muñoz-Zanzi. Dr. Muñoz-Zanzi is an associate professor in the Division of Environmental Health Sciences at the School of Public Health, and she is working on the epidemiology and social ecology of zoonotic and other emerging infectious diseases affecting public health globally. And today she'll be speaking to our environmental justice theme from a global health perspective, specifically discussing current challenges in environmental health that contribute to health disparities, with emphasis on neglected and other infectious diseases of poverty. So thank you so much, Claudia, for being here, and I will turn it over to you.
Wonderful. All right. It's really a pleasure to be here, meeting new people and sharing what I do. So as was mentioned, I'm an infectious disease epidemiologist. So I will provide some examples of my work sort of in the second part of the talk. And in the first part of the talk, I just wanted to talk more broadly about health disparities and their importance. So that's why, to be able to make sure that we're all sort of on the same page, I just wanted to kind of bring a reminder of the effort done globally to improve health disparities. So in June of 2012, the United Nations and member states decided to launch a process to develop a set of sustainable development goals to build upon the 8 broad Millennium Development Goals that ended in 2015. A key realization of the Millennium Goals is that although significant improvements in health have been achieved, persistent inequalities in avoidable health risk and premature deaths remain between and within countries. The 17 Sustainable Development Goals and their targets balance the 3 dimensions of sustainable development: the economic, the social, and environmental. The goals seek to realize that human rights of all and pledge that no one will be left behind. Here you see number 3, good health and well-being, and number 10, reduce these inequalities, which are the ones I'll be touching on today. There is ample evidence that the circumstances in which people are born, grow, live, and work impact their health outcomes. Income and social inequalities have significant adverse health outcomes. Those circumstances determine people's risk of illness, their ability to do something to minimize the risk, or to practice preventive measures, and the ability to seek and or to obtain proper care if illness occurs. We're increasingly understanding that inequalities can impact health through multiple and complex pathways, including increased psychosocial stressors since childhood and higher rates of individual adverse health behaviors, such as smoking and alcohol abuse. Inequalities also involve a lack of access to environments that promote health, such as decent housing, a healthy diet, opportunities for employment and for leisure activities in safe spaces, and a physical environment that does not expose residents to adverse conditions. The impact can persist, of these conditions, can persist over the life cycle and passed down through generations, which means that solutions are just as complex. So here I just created this diagram to try to convey how broad the impacts can be, environmental hazards can be. So we have in the first top rows extreme heat and increased seasonal temperatures, which in case of health disparities comes from people who have no means to escape these conditions, to avoid exposure. And if they become ill, to seek proper care. Women are especially vulnerable because of pregnancy. And then not only that, but in the fetus as well, because of the heterogenic effects of heat. So then we have air quality, where we know that, some groups, tend to live in places where there's more pollution, and there's no way to escape those conditions. In terms of indoor pollution, women also have increased burden because of the time spent inside the house in those housing conditions where they use the stoves for heat and for cooking. Then we have climate-related disasters, where again, a large fraction of vulnerable populations, they have no means to escape these emergency situations. And even if they do, they don't have the social, economic, educational support to recover from those events. In terms of migration, displacement, urbanization, changes in landscape, all of that brings about a lot of different hazards, and with people who are not able to escape those conditions and seek development opportunities. Then diseases, which is the part I will be talking about, this last two over here, we'll be talking more about, is again, has to do a lot with location, not being able to afford care when they become ill, and gaps in the surveillance needed, to identify these areas. And in terms of water, poor water quality, food, and water insecurity. Traditionally, women have the role of providing water for the family, and they spend, a considerable amount of time seeking, looking for this water instead of spending that time, either in education, if we're talking about girls, or women looking for jobs or having other employment opportunities, to gain financial stipends. And not only that, in addition to the time spent collecting water, also they are exposed to physical harm and injury. And then in terms of food security, also have a huge disparities in many parts of the world because of cultural practices where, with the little food they may have, is given to the male children or the men in the house first. Now, so my work is on infectious diseases. So I'm going to highlight, that aspect of this, broader problem. So here, pathogens refer to a broad variety of disease-causing agents, including bacteria, viruses, and parasites. To date, there are more than 1,400 known species of human pathogens. These pathogens are mostly transmitted to humans zoonotically from animals, and a large majority of the emerging pathogens are zoonotic. The transmission mechanisms of the various pathogens within the natural host species and between species, including spillover to humans, depends on their natural history, the ecology, and can include vector, water, food, or airborne mechanisms, transmission mechanisms, among others. So, human transmission can be more or less influenced by environmental factors such as temperature, precipitation, in addition to living, social, and demographic factors. For example, land use changes in parallel with temperature increase may contribute to the spread of vector-borne diseases such as malaria, dengue, and Zika by moderating vector activity and the closer proximity to people due to the land use changes. There are plenty of examples of these diseases affecting people worldwide, manifesting as high incidence rates or recurrent outbreaks of different magnitudes, and most often with the largest burden among the most vulnerable. As we all experience it with COVID-19 right now, some of those have devastating public health, social, and economic consequences. But even the ones that are not pandemic, locally can have significant consequences. All right. So now, in terms of health disparities, I want to call your attention to waterborne diseases. Well-known examples of these diseases are cholera, campylobacteriosis, giardiasis, toxoplasmosis, leptospirosis, hepatitis, schistosomiasis, dracunculiasis, and many others. WHO estimates that diarrhea is a leading cause of deaths, some of that caused by these pathogens, among children under 5 years, causing over 1.5 million deaths annually. But not only that, among those children who do not die, diarrhea can lead to stunting, cognitive impairments, or delays that will put them at a disadvantage for life. Water is also an important part of the mosquito's life cycle in vector-borne diseases. And additionally, as you know, presence of heavy metals, pesticides, and other chemicals are also important health risks. This diagram represents how people interact with water in multiple ways to increase the risk of disease. Authors here state that this concept, it is based on the notion that the ability to secure safe, affordable, and socially acceptable water and the capacity to cope with everyday water challenges are both profoundly shaped by social relations and power. Those relations are influenced by gender, race, age, socioeconomic status, and many other social determinants. So looking at the diagram, it shows the ideal path, will be for water to come from the source through water treatment, and then to a convenient delivery in the quantity and quality needed. Here, and I don't know if you see, I don't know if I have a pointer, but so here you see, the potential for contamination at the source, that a lot of that depends on the location. These are possible hazard levels of collection points, from properly managed taps or water tanks to unprotected wells and open surface water sources subject to contamination from weak sanitation, flooding, animals, etc. So, as mentioned earlier, proximity to collection points poses a huge burden to people, not only due to the time spent collecting water, but also due to the need to store the water. They may not have enough for the needs and the increased risk of post-collection contamination. Poor households may not afford closed containers and may not have the means to keep them clean. Even if people use methods to decontaminate water, they may not produce large enough quantities in order to store it properly to keep it clean. Storing water means people also may need to have containers for animals for domestic use or live close to locations where surface water may puddle collect for irrigation or for their animals. All of these create habitats for mosquitoes and rodents, leading to pathogen transmission. So that leads us to the efforts to trying to do something about all of this. So the need to evaluate the progress towards the global health targets is promoting the development of better indicators. Indicators have taken on a range of functions, including quantifying and characterizing exposure, vulnerability, and risk for both populations and the health systems that are needed to handle those risks. They are also used for identifying and tracking key impacts on population health and evaluating changes in the capacity to adapt and resilience. The example that I have here is for a dengue, a mosquito-borne disease. The first picture is on trends in environmental suitability for dengue transmission, which is made by combining all the environmental key factors on vectorial capacity. it's like temperatura, water, and temperature, water, and all of that, right? And you can see that it shows that has been increasing, especially in the last 20 years. The second is showing a calculated vulnerability index factor, where this index, factors in the characteristics of the population and the health system in those affected regions. Now, this index is at the country level and assess the ability to control outbreaks through relevant public health measures. So as you see, vulnerability has been going down. So, it seems to be improving, even though the risk may go up of transmission, but that means that the health system, is able to cope with it. However, if you disaggregate the data, you will see that this improvement is really variable, and more recently, the index actually is going up again. Key importance of this type of work and expanding it is, and expand this type of work. We can use this to visualize geographic areas that may be experiencing increases or decreases in disease risk, to identify locations that require more research for a more accurate understanding of infection risk, and to highlight specific groups or populations where inequity gaps require urgent intervention to reduce their vulnerability to these public health threats. Okay, so now I wanted to sort of in the second part, I just wanted to talk about some of the examples of my work. And one of the diseases that I study, mostly is leptospirosis, which is a zoonotic disease. And here, this diagram, explains it's a very complex disease in terms of transmission dynamics, because it can be in multiple species. Rodents are one of the most important reservoirs, but it can also be found in many other mammal species. It's transmitted, obviously, it's maintained within each one of these populations, but it also is cross-species transmission. And the bacteria is shed through urine to the environment. So it persists in the environment. So we believe that most of the infection in people and even some of the animals is really through a contaminated environment, that is soil and water. So now, as you can imagine, the overall dynamics of infections are heavily driven on the interaction between people and the animals and the contact with their environment. And all the typical environmental variables that had to do with temperature, with rain, diversity, landscape use, influences this dynamic. Now, how it's presented? It is globally, is everywhere, but the highest incidence are in the tropics and subtropical areas, but it can be also in temperate areas, just at different endemic levels. Then, if I want to emphasize these, a kind of outbreak, there are sporadic cases, seasonally increases when there is more precipitation, and can also cause outbreaks. Some of them can be small, due to contact with livestock. It can be an outbreak of 2-3 people, farm or slaughterhouse workers. But it can also be a massive outbreaks with it has been thousands of cases in the tropics, like in Thailand and Indonesia, where due to monsoon rains or heavy flooding. Now this, as you can imagine, going back to the determinants of infection, it can occur in slums due to high presence of rodents. It can occur in rural areas, and anywhere in between. So it's really throughout. Now, as I said, rodents are a very important reservoir for the disease, and believe most of the infection is coming from rodents globally. Now, we don't know exactly the actual mechanisms of how they contaminate the environment, but these are some presumed, options or possibilities, which is, how we're linking, rainfall and floods to increasing leptospirosis cases. Now, one would be, for example, that increase in rainfall creates abundant food sources. So then consequently, after a growing season, in the next season, there's going to be plenty of food for the rodents, and there will be an increase in the rodent population. And as you know, if you have seen the news recently, it was in Australia. If I forget, yeah, it is in Australia. There was they have a huge outbreak of rodents. They were like running all over the place. So this is actually happens in different parts of the world, different times, depending on these cycles in food sources. Then the other option could be displacement, where floods displace the rodents, and therefore they seek protection closer to human settlements or the houses, the environment. So they're coming closer to where people are, they contaminate the environment, and that's how people become infected. Also could be that people, are closer to, the natural environment due to seasonal changes. They have to work in the farms, for example, or in the rice fields, or due to natural disaster, that may put people at risk. And lastly, it could be that a combination of all of these factors on top of disruptions in the health system. Therefore, there is interruption in rodent control, and and also in the ability of people to seek care, if they become infected. Now, this is the most recent research about leptospirosis. Is that until recently, we couldn't really understand well what the role of the environment was. So now that we have the ability to detect bacteria in the environment and soil and water, there are several hypotheses of the role of the transmission. So now we have this idea that it can persist. When we know they can persist for a long time in the environment, now it's believed that it can persist in the soil. And when there is an increase in rain or floods, the bacteria kind of gets, drifts or moves to the surface where it mixes with the water that's moving. And that's how, can expose a large number of people that are in these vulnerable situations. And that's how outbreaks occur. So for the same reason, we need to do more to understand, the interplay of all of the different factors. And as you can imagine, it's really a complex problem that needs a lot of multidisciplinary work. So this as an example of a little bit of that work that I did a while ago, where we're using methods to detect leptospira in the environment. And then this was based on testing just puddle water around households. We detect the presence of the bacteria, and plus several covariates and other variables to be able to take into consideration other factors, and we come up with this model. So basically what this is a slum area in, this is the actual sort of city, more urban city. These are informal settlements up in the mountains. And so we collected the waters and we did some modeling work. And this is an example, a map that will say where the high risk areas are of, for environmental contamination. And then, that will be able to inform public health, the local public health department about what to do. Who put the lepto there? It could be the dogs, could be the rodents. That is, more work needs to be done for that kind to answer that kind of questions. But at least is to increase the awareness of the contamination problem. So this is the idea with this figure here, where we're saying that now with the tools that we have, we can do a better job in doing environmental surveillance, which is for this pathogen. I will be an example for many other pathogens. So in some way, it is done for cholera, for example, and some were done with the viral diseases and polio. They do environmental surveillance. For lepto, still baby steps. But the idea will be here, if we're able to monitor the environment, especially in these high risk areas, prospectively, not only know where is this presence of the leptospira, but also the concentration. we can come up with some proxies for indicating when the contamination is high enough, they can trigger outbreaks or more problems. Now also, with advantage of genotyping, plus if it's linked to proper animal surveillance, we can start doing some source tracking and not only identify when the environment is contaminated, but also the source of infection. So now a little bit of the work I'm doing right now. Right now I'm working on a project in Puerto Rico. And I don't know if you remember a while ago after Maria, when they had that huge, devastating, problem after the hurricane, where they lost electricity for months, the whole country pretty much shut down. And people living on the streets, they didn't have safe water. And so that was in the news, that months later, when they started to really figure out the causes of the high mortality, leptospirosis, jumped out into a significant reason for a lot of those deaths. So there was an outbreak that occurred in the entire island. It was at that time not recognized. So right now I'm working, before that, so what was the main problem in this specific situation was that leptospirosis has always been in Puerto Rico, and they have some number of cases, we'll say dozen of cases every year. And it came to the realization that the actual burden was probably much higher than that. It's just being undetected. So there's a huge underestimation of the true number of cases. And as you can see, without that information, it would be really hard to convince decision makers, about what things can be done to try to alleviate the problems and prevent future outbreaks. So I don't know if you're familiar with this, the pyramid of illness, but now that probably you have heard about COVID all over the news. So some of those things now may sound more familiar than before, which had to do with, that a large number of people can become infected, but some of them are asymptomatic, so have symptomatic and asymptomatic. Then, so this is a smaller and smaller fraction, because these are a fraction of those people are symptomatic. Then a fraction of those are sick enough, to want to go to the doctor. And then if they go to the doctor, then dependent of the specific situation, and normally it's correlated with how ill they are, the physician may or may not, ask for diagnostic tests to identify the actual etiology of the illness. And then, if identified, then those cases are reported into the surveillance systems. So normally what we see, what we see is what is reported, which is the tip of this pyramid. So you can see here that, if we assume make some assumptions about this, which is for leptospirosis, this is kind of about right. Out of 1,000 cases that we see, the true number of infections are, 10,000. So going back to Puerto Rico, this with this idea in mind, we're working on a project with CDC to try to understand better the burden of disease in the island. So this is work that we did, taking into consideration all the variables that influence risk, infection risk, the landscape characteristics like vegetation, elevation, rainfall, temperature, demographics. We put all of this together in the model to come up with this vulnerability map across the island. So here we see the highest points over here. And based on this, now what we're doing is a project where we are enrolling patients based on presence of fever, not a lepto, but fever, which is a chief symptom of this illness and many others, febrile illness. So we have now sites across different hospitals in the island, enrolling these patients, following very specific protocols. And we're trying to identify how many of those are leptospirosis. Together with that, we are doing capacity building to improve their capacity to identify and diagnose those cases. And we're also we're in the middle of doing house visits to sample animals to start doing the link, between the human cases and the potential sources of infection. So, the idea of this is that, after we put all the data together to be able to inform the risk factors for infection, the hotspots, and then to start implementing public health measures to prevent, future outbreaks or to decrease incidence. Now, a key point that I wanted to talk, and hopefully you will see at the end why this is important for environmental health, is access to early diagnosis and treatment. So we know that health outcomes often depends on access to care when it's needed. But health systems, especially in low resource areas, cannot really make every single option available for care. They are forced to make decisions of what to make available and in different systems. And sadly, more specialized care tends to be used disproportionately more, for those people who can actually pay or access. They can either travel to the hospitals or they can pay for the care they need or they want. So in the case of febrile illness, diagnosis is important because there are many diseases that are present in the same way. So we really don't know, if it's leptospirosis or it's dengue or malaria or something else. So ability to have access to laboratories is very important. So this is a diagram showing in a paper that we did, when we're trying to compare different options for diagnosis and trying to identify the most cost-effective diagnosis for febrile illness, identify the etiology, and then inform treatment with antibiotics. So basically, what I want to point out here is that, as I said, some people may have the mild presentation, or people have the severe presentation. Now, if they're mild, some of them may go to a hospital. Some of them may be tested or not. So sort of this is similar to the paradigm of illness that I showed you earlier. And some of them may just be sent home, and others may receive antibiotics depending on the test results or what the physician wants to do. Severe normally are hospitalized, but they also go through the same sort of chain of events and decision making, to see, to treat the patient. So now, I don't want to go through the whole table, but this table is the results, of this modeling work comparing different testing strategies. So what I want you to remember at the end of all of this table is that when we're trying to diagnose febrile illness, they can be viral infections, they can be bacterial infections, and which infections are happening in any given place or location really depends on what's circulating at that time. And not only that, but depending on the time of the year, maybe leptospirosis, maybe more important in some times of the year, and maybe dengue and others. So, and which factors influence, the relative importance of each one of these infections is normally environmental variables, temperature and precipitation and things like that. So in the ideal world, every clinic, every hospital will have all the tools, available and test people for everything they can think of, right? So in this example, what's highlighted here is that we have different tests to offer. Now, most of you are familiar with rapid tests. So we have rapid tests for lepto, for dengue, and for typhus, which are the three example infections that I had in this exercise. We have rapid tests, we have PCR tests, and we have what's called a multiplex PCR, which is very expensive, but you can test for all these diseases at the same time. So we have here different combinations. As you can imagine, rapid tests are cheaper, but are not as good as PCR, right? And as I said, the multiplex is the best, but it is just very expensive. So the message here is that how we link this back to the environment is that when we're trying to expand this work is to set up a system in which environmental drivers, current environmental drivers, can inform, what hospital and health system need to have available, and at different times of the year, depending of what diseases are more important, at any given time. This is another example of linking, environmental drivers with public health decision making. This is an example of a colleague in, she did this work with leptospirosis data in Nicaragua. So she did the modeling work, investigating the factors, the variables, environmental variables, including soil, elevation, temperature, rain, demographics. So she put together all of these. And based on that modeling work, she was able to identify the time in terms of the months of the year and the places that are critical areas of high risk versus lower risk. And then, so she, at the end, this is the recommendations, was that, is putting all of that together, she was able to, this is an example for two areas. This one over here is the hotspot or critical area, and this over here is another municipality. Now it's just endemic or lower risk area, and what to do every month in preparation for October, which is where the outbreaks or the highest incidence rates occur. So we'll say that in the critical area, in the previous months, up to July, is basically about preparedness, about training. I have, the team is ready to go. In July will be about training about rodent control, maybe implementing some improved rodent control measures in August. And then in September, they going to start with like a timely information, educational programs to the population. And then in October, the whole health system is alert, expecting that the cases are gonna come and they're gonna and they have the tools to diagnose and to treat people. And then what to do in these other areas that were not classified, that are endemic or the lowest risk, is basically, still provide some preparedness, but basically be on the look for cases by enhancing surveillance. So this is an example, of putting all of those things together. Then this is another example, and last example, where I want to show what happens, when, this took a long time. It was really decades of work, for this group, and not this group, but the researchers plus the local health department and government to make this happen. This is in Brazil, in Salvador, and the slums of Salvador, where they have urban leptospirosis, one of the highest, very high incidence rates. And as you can imagine, the slums of Salvador, the favelas, where they have all the perfect conditions, from the rodents to the housing conditions, no water, no sanitation, poverty. So all of that together leads to really high incidence rates. So over time, what they did is that they had a multi-pronged approach. They did health education, they did targeted control, but they also realize that it's just not enough. So through community leaders, they secure funding, with local government to build a closed sewer system. And the good thing about this site, it's a good sort of case exercise, because they have, through the researchers, they had very good surveillance data, active surveillance. So they've been monitoring the incidence of leptospirosis during several decades. So they were able to really see, this is sort of natural experiment. They were able to see the decrease in the incidence after they implemented all these measures. Now they see that, infection risk for people decrease, but they also, with more research, they also, they also say that the rodents may not disappear. Some of them are still there, but even the prevalence of infection in the rodent population decreased. So, through those two things, they hope that the burden in this particular area will be decreasing over time. And now they're expanding to other areas in other urban areas in that part of the country. So some final thoughts. So we need to keep promoting initiatives and methodology to quantify and characterize exposure, risk, and vulnerability for population and health systems. It is important to identify and track key effects on population over time and attempt to identify the environmental components within the infectious disease dynamics to help inform adaptation, mitigation, and surveillance strategies. The challenges of accurate data. We need disaggregated data at the necessary spatial and temporal scale and by age, sex, race, income, and other social characteristics. Data are needed for these indicators, that I mentioned above previously, but also to increase awareness by local and national decision makers and healthcare personnel. Several interdisciplinary and intersectoral concepts have been proposed to offer a more proactive and holistic framework to tackle these challenges, such as eco-health, One Health, planetary health. All of these underscore the important role of the environment in truly achieving the goal of not leaving anyone behind. Now, solutions are not easy, as we saw for water, for example, and need a good understanding of the right approach and good entry and integration points, so they lead to increased and permanent health equity. So with that, I now thank you and I welcome any questions.
All right, thank you so much, Claudia. I think most folks know the drill by now, but as always, you're welcome to unmute if you have a question or put it in the chat, and I'll keep an eye on the chat.
Hi, Claudia. I have a question. So you mentioned the example of Puerto Rico as a place in the United States that, had this high infection rate after a natural disaster. Are there other places in the US that are particularly vulnerable, especially from, like an extreme weather event or a climate change related event?
Good question. So for leptospirosis specifically, the highest, if you can tell the states or the places, the highest incidence is Puerto Rico and Hawaii. So they're endemic, they've always been there. Having said that, and they both have outbreaks and all of that. Hawaii is very different from Puerto Rico, as you can imagine, and in terms of their resources and ability to cope and all of that. So I think that's why it's a big differential between the two islands. Now, in other parts of the country, they have outbreaks, and most of the outbreaks are really occupational in agriculture. So it's not the same kind of hazard, because they're very point source. And even though, what's interesting to me is even though we have plenty of floods, right? And every season, every time, you can see massive floods everywhere. But I think that and then there are some sporadic cases that occur. So I think that it's just the right balance, that the level of contamination is not high enough to expose enough number of people to cause outbreaks. So we don't see the same numbers as we see for lepto. Having said that, there are many other diseases that that can be present in the water. But I think it's the the U.S. being a more developed country, it's with source systems that have better quality, it's not the same level of exposure that you will have, if this kind of flood occurred in other places where that doesn't exist.
Thanks so much.
I'm going to stop sharing so I can see both people's faces. Yeah, yeah.
Yeah, I have a question. Are there public health people who are working with climate modelers to come up with predictions for, I mean, I'm just thinking about trying to sell more and more
Yeah, good
the
question.
awareness of the concerns.
Yes,
and
yes.
I'm just curious whether.
Yes. I definitely, and there are great groups in other places, and I'm hoping, I'm eager to increase that kind of work here in Minnesota, in the university, to really bridge the gaps between like my department and you guys, and see, because there's plenty, and that we are behind, and the people locally, we have the expertise, but it's just we need the people sitting together and it's the brainstorming, what how we can contribute. No, there are plenty of groups, from North Carolina, from Emory, Yale, and there are plenty of other groups, Berkeley, that they are doing this kind of work. And there's plenty of work to do, it's not like, there's still plenty of work to do. So I think it's just, I'm hoping, it will be a matter of, of start writing those proposals and start bringing people together. Yeah.
Thank you.
I got a quick question. Do you have any soil? You talked about geography and soil indicators. Was there anything specific that stood out that associated with the disease that you could?
Yeah, there are. I will not remember the names of the type of soils, because they're hard to say. But yes, there is research, that actually have looked at, and these are correlations, associations, because it's based on surveillance data, and with the type of soil, that is present in the places, where there are more cases. So and I've seen several studies where they actually been able to identify the type of soil present where there are more cases. And they have explained it as the type of soil that is able to maintain more moisture.
Oh, yeah.
Yeah.
Okay.
They have specific names. I can share the papers with you. That I don't remember the names of the type of soil, but also agriculture, like tobacco growing, obviously rice, but not only rice. Tobacco is one that was sort of like, why tobacco? And I think it's the type of soil where they put the tobacco that is more important than the tobacco, crops themselves.
Thank you.
Just to develop more on that is that in the Nicaragua work, I remember she also looked at some significant variables that had to do with the soil type, and some of them were sort of in the volcano areas. And so I think I would love to be able to do actual experiments with survival, of lepto in the water, different type of soil and things like that. Because I think the idea now, we always thought, it was just the rodents and that's it, stay away from the rodents and you're good. But knowing now that soil actually acts like as a reservoir of the pathogen, so that makes that's a totally different game, right? And they can persist for a long time. So understanding how that occurs, and then how So now it's just not a localized problem, because it can spread and it can diffuse, to other areas and persist there for a long time.
Yeah, I wonder if organic matter might be associated with it from that standpoint. It might be I don't know. Is this an obligate parasite that needs humans or animals to live?
No,
so it might live off of
no. So I think the understanding is that it cannot, once it's shed into the environment, can survive there for many, people say, several weeks to months, spiking experiments in the lab, so that it showed, it can persist for several months. But, let's say several weeks, which is enough, to pick up another host, and it continues. I think that the standard is that it cannot replicate in the environment, it just stays there. And then, it can persist, it kind of protects, itself using biofilms. And it's just there, just waiting, basically, waiting to be picked up by a host. And yeah, so I think the whole thing just seems very interesting to me. Yeah.
Yeah, I think in Nicaragua, the volcanic soils are really fertile compared to other areas. So I would imagine both because it's from volcanic ash, which would you would probably get more organic matter, growing a lot more biomass in those systems, you would also have more organic matter. So yeah. I would guess that is related. And I imagine landscape position, like if it's low lying, so you're going to have more water in those.
Yeah. And there is some not modeling work, but actual analysis of data where it shows so nicely how people living downhill, the slope, those people have more cases, high risk than people going uphill. So it's just very interesting work, doing that. And at a very small community level, it's just really like in this community, you just can see that the cases are occurring downhill.
Interesting.
Claudia, I have a question, sort of theoretical. Do you think now that we have been through COVID for a year and that sort of changed the face of rapid testing and innovation in those regards, do you think there's ways that we can use what's been developed to work on some of these other diseases, these other zoonotic diseases?
Yeah, I think that, if that doesn't happen, it will be crazy. Well, the amount of effort and millions of people that they're using developing this new test, if they don't take advantage of the technology to expand it to other pathogens. But I started to see, even in one of the sites that we have in Puerto Rico, some of the hospitals, they actually received equipment for these automatic PCRs that, they were running it for several tests, for several diseases. So even now, people are already seeing improvement on what they used to have. They used to have nothing. They had to send the samples abroad and to the US or to the CDC in Atlanta, and we'll never hear the results back. It was just horrible. So even now they started to see a change in that trend, and hopefully it continues. Yeah. It's the cost. It's always about the cost. Right now, everything's pretty much free because of COVID. But then we'll have to see what happens. After people have to start paying.
Yeah. Thank you. All right, we have just a couple minutes left. Are there any final questions for Claudia? Not seeing any in the chat, so if not, just I want to thank you again for being here. This was really, really interesting, and hopefully, like you said at the beginning, Claudia, they can help foster some connections that can continue to explore in the future.
Yeah, certainly. Yeah. Thank you very much for inviting me.
Thank you.
All right, have a nice evening.
Right. Yeah, thanks again. Thanks everyone for being here. Take care.